This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Aches, pains, and fever, many of us reach for the acetaminophen without blinking an eye. After all, it's a pain reliever found in almost 600 medications.
Many of those medications are available over the counter and sold under popular brand names. But acetaminophen can also be found in prescribed combination medications, including oxycodone, hydrocodone, and codeine.
Now, for the second time in less than 6 months, the Food and Drug Administration has come out with another warning about acetaminophen. You may remember back in August when we told you the FDA announced acetaminophen had been linked to Stevens-Johnson syndrome, which can cause the skin to blister and slough off the body. The makers of brand name drugs that had acetaminophen in them were required to use black box warnings to call attention to these serious risks. Black box warnings are the strongest form of a drug warning.
Now, in this latest warning, and you've probably seen the headlines, the FDA wants doctors to stop prescribing combination medications that contain more than 325 milligrams of acetaminophen. There's concern that these high doses of the drug can lead to liver damage, even death. The scary thing is that the FDA also says it can be easy to accidentally take too much acetaminophen.
So what do you need to know to keep you and your family safe? Well, here to help us sort this all out is Dr. Chris Snyder, Chief Medical Informatic Officer and Hospitalist with Peninsula Regional Medical Center. Thanks for joining us, Dr. Snyder. How is this going to change the way doctors write prescriptions?
Not sure it's going to change. I think more the education will go between the providers, nursing staff, and patients. We've had an awareness about acetaminophen issues for years because we deal with those problems. But the combination medications, absolutely, I think that you're going to see an improvement in patients being more aware of the potential risks associated with it.
Let's talk about outside the hospital. Now, one of the people that we work with actually has a cold, and she noticed that on her medication, each capsule contains 325 milligrams of acetaminophen. Now, the recommended dose is 2 capsules every 4 hours. So, according to the new FDA warning, that's dangerous.
Yeah, so the FDA warning really has reduced the dose, the daily dose, significantly by 1,000 milligrams actually. So the prescribed medications will have that actual label applied to it starting in this year. Next year, hopefully we'll see the over-the-counter medications also have that awareness. And that seems to be the problem. It's the combination of what I prescribe to what is utilized in the outpatient setting. So folks can go buy this acetaminophen over the counter. Everybody uses it. So it's one of those common medications for headaches, colds, whatever, and we use it a lot. So you got to be really cautious. So I think you're going to see your healthcare providers being a lot more attentive to making sure that folks realize that multiple doses of Tylenol in a day can be dangerous. So, and following those directions is the key.
Absolutely. Just take a look at the directions. Okay, so would I know if I took too much acetaminophen? I mean, are there signs or symptoms?
Yeah, typically with an overdose acetaminophen, you're going to get a lot of signs and symptoms associated with yellow skin. Folks who have acetaminophen or overdoses typically are those folks who are associated with liver problems. So alcoholics and folks who have hepatitis are at much higher risk. But for the common individual, you're going to see things, dark urine, you're going to see yellowing skin, yellowing of the eyes. You may actually have itching associated with abdominal pain and nausea and vomiting. So those are probably the biggest areas where you're going to see emphasis on that. But that's pretty severe. So you're talking about a fairly large dose. And we actually measure levels of acetaminophen in your blood if somebody presents with those kind of symptoms.
Okay, all right. Well, we've been hearing lots about the negative effects of acetaminophen. How about some of the benefits?
Fantastic drug, been around for years. Actually, has been utilized in pain management for 20, 30 years, 3 decades. It's in combination with a lot of medications for that purpose, but I think one of the impacts is fever is a main thing, and we use that a lot in infants. We use it in our neonates in our critical care setting at the hospital. So it's a very safe drug to be utilized if it's dosed properly. The other things obviously are pain. So pain and fever are probably your 2 main areas where we use this drug.
What about arthritis? I know a lot of people take it for that.
Yeah, well, arthritis is one of those things that hurts, so that's why people use it. Arthritis, the inflammatory process is not affected by Tylenol or acetaminophen whatsoever. But you know, when you use it in combination with the anti-inflammatories or in replacement of the anti-inflammatories, it will impact pain control, but it doesn't really necessarily play with the anti-inflammatory effects that you want when you have an arthritic flare.
How about with children? How about our kids?
Yeah, so kids use this. Main use in children is typically post-operative pain. So you see it in a lot of tonsillectomies, for example. So we'll give folks for pain control after that, along with a narcotic usually. We'll also use it in fever, obviously, and for fever that's not controlled. And again, using these medications for more than 2 or 3 days, it should tell somebody, a mother or father, that they really need to seek more medical attention if it's not resolving with the doses that are prescribed over the counter.
Right, because none of this is supposed to be taken for more than a day or two, right?
Yeah, and a lot of these meds that we pop pills on, you got to be really careful with. You're putting a chemical in your system,
Right.
and there's some significant responses you can have.
And it's not just the acetaminophen, it's other medications that can do some damage, right?
Oh, absolutely. Anything over the counter. So again, they're chemicals. And you got to remember, there is a risk with anything you put in your mouth. So make sure you read labels. A lot of folks don't realize acetaminophen is abbreviated as APAP. So APAP is the chemistry of it, and that's why it's put on the bottle. But again, it's not really highlighted. It's in that itty bitty little teeny print at the bottom of the bottle. So you really have to be cautious, not only what you give your children, but what you take yourself.
Okay, so the bottom line is pay attention, make sure you know what you're taking, and just because you're taking a pill doesn't mean that we're safe.
Yeah, and ask questions. Don't be afraid to ask your providers, ask your pharmacist, ask your nurses, ask somebody who understands pharmacology about these things, because there is risk. And anything you put in your mouth, Benadryl, acetaminophen, any of the ibuprofens or anti-inflammatories, got to be careful. So they all have risk with them, and using them long term is dangerous.
All right. Dr. Snyder, thank you so much. Good information. Read those labels. And if you'd like to read more about PRMC and about acetaminophen safety, go to delmarvalife.com and click on the show tab. Now, another common medicine that people take is also raising some eyebrows, particularly when it comes to our children. Join us Monday as we learn more about Reye's syndrome, what causes it, and who's at risk.
But coming up next, our pets are part of the family, and the last thing we want is for something to happen to them, like go missing. So what do you need to do if that happens? We go on a ride along with Delaware Animal Care and Control to find out.
And later, we're getting pumped for the NFL playoffs this weekend. We're in the kitchen with a tasty snack that will go perfectly with any game watching parties you have planned. Delmarva Life, we'll be right back.